We are going to start our first panel of the conference. And if any of you are kind of in the corners or the back and you want to move more to the center and be closer to our panelists, that would be great. Otherwise, we just want to welcome you all to our first panel of this conference. We're especially excited to kick things off with a discussion around the sharing economy in healthcare. We've gathered industry-leading companies who will present their vision on a collaborative world where healthcare becomes the realm of society rather than just the individual. And I just want to make a quick reminder as far as Q&A goes. I think everyone is pretty good about this, that please ask questions, limit the comments, and if you want to talk to the panelists one-on-one afterwards, please do that. And we'd also just like to say that if a company is a startup company, to refrain from questions around profitability, revenue generating, what is your business model, all of those questions, because you just won't get an answer. So just sort of throwing that out there. And with that, I'd like to turn it over to Brianna, the co-head of Indiegogo Life.
Thank you. Well, we're really excited to be here. We've had some fun pre-panel conversations to queue us up. And I'd love to pause and give our panelists a chance to introduce themselves, say who they are, the work that they're doing, and why they were inspired to do that work. So I'll just kick us off. I've been instructed to participate both as a moderator and a panelist, so I might share a few more thoughts than a normal moderator would, so please forgive me. My name is Bree DiGiamarino, as mentioned, and I'm the co-head of Indiegogo Life. Some of you may know of Indiegogo Life, more of you may know of Indiegogo, which is the world's first global crowdfunding company founded back in 2008. For people to pursue the change they want to see in the world by putting their ideas online and rallying their community and the greater world to support it. We have grown a ton since launching back in 2008 at Indiegogo. Now we're in more than 200 countries and territories with campaign owners and contributors in all of them. We have millions of people who contribute to the site. We now have about 15 million visitors a month and millions of dollars going to thousands of campaigns every week. What we were finding over the past couple of years was a particular growth in our personal cause space of individuals supporting each other and themselves through Indiegogo. So what we did was delve down into that and actually spun out a new site called Indiegogo Life in December to really focus on supporting those individuals with a platform that's dedicated for them, with a very simple to use product that only takes 8 clicks to launch a new fundraiser, very strong sharing tools, and no Indiegogo platform fees. So it's a free site to use. And what we have found on that site, and why I'm here today, is that medical fundraising is a very large category for us. Medical and community fundraisers make up about 60% of fundraisers on Indiegogo Life for a huge variety of purposes. We can get into the value of those and why and how those medical fundraisers are changing medical care, but I'll save that and pause so that my panelists can share who they are and what they're doing.
Okay. My name is Lisa McNeese, and I'm a community director for Care.com. About a year and a half ago, a friend of mine and I established a company called Parent Clubs on Board, and we were doing leadership development with the parent clubs in the Bay Area, which make up about 15,000 to 20,000 families just in the Bay Area. Care.com bought a platform called Big Tent, which is the software that the parent clubs are using, and it made sense for us to join forces with Care.com about a year and a half ago. So we're working with parent clubs to help them stay sustainable and connect them to Care.com matching services. The belief is that for families to succeed and for moms to succeed, they need a network of support from their community, as well as babysitters, pet sitters, senior care, and that all of these things go together to help women succeed in their careers and have happier, more fulfilled lives. My background is in women's health. I spent quite a bit of time working for Planned Parenthood, and our focus has really been on how do we help women connect with each other and create support for each other. So we're continuing that from Parent Clubs on Board into care.com.
Hi, my name is Jessica Greenwald. I'm one of the co-founders of CrowdMed. We're a company that is solving difficult medical cases online using the wisdom of crowds. And we've been able to solve cases that have cost the traditional medical system 6 figures, taken dozens of years. We've solved those types of cases on our site in a matter of weeks in some cases. Reason we did this is because 2 of us have gone through pretty tough diagnostic situations ourselves. My co-founder's sister got really sick and spent 3 years trying to get an answer. 6 figures, like I said, for some of our other patients. And then I personally got really sick in college and had to go through a barrage of tests to try to figure out what was wrong with me and go to a series of specialists. And my case was actually one of the first test cases we ran on our site. In less than a week, our crowd was able to get the same answer that my doctors had gotten to after putting me through just an intense amount of tests. So that's when we found out we had something that had the potential to save a lot of lives and help a lot of people. And actually, we're running an Indiegogo campaign right now on Indiegogo Life for patients who have been suffering from undiagnosed medical conditions. As you can imagine, it's really expensive to go from doctor to doctor and not get an answer and end up being treated for all these conditions that you may or may not really have. And what will happen is these patients will go into debt. They'll have to lose their jobs because they can't continue to work in the condition that they're in. They just keep getting worse. So we teamed up with Indiegogo to help them get to start a fundraiser for them and help them get more attention on their medical case so that they could hopefully get a real diagnosis for the root cause of their suffering and start treatment.
Hello everybody, my name is Ash Dhamle. I'm the CEO and founder of Lumiata. And one of our primary goals is really how do you democratize medical science? And towards that goal, what we've really been doing is how do you marry basically data science with medical science to really make it available throughout the entire world, literally in real time, so that at any moment in time, when you have a set of questions, symptoms, previous diagnosis, whatever data you may have, how can you benefit from the best of medical science being there to help guide what is that next step, the next possibility? And towards this exact point of how do you leverage the literally millions of insights that we've generated so far and new ones to come to date to be able to sort of dramatically reduce the time from bench to bedside or bench to anywhere, one would say, in a matter of minutes or seconds, right? And so really, we bring these 2 worlds together, really be able to predict, the current clinical state of someone and what best next to do. So we're really excited about how we enable and empower people overall in the overall production of care.
Thank you. Well, it's a treat to be here with all of you today. One of the topics that we're talking about is the sharing aspect, right? And when you think about sharing, it means there are multiple people coming together. Now, one thing that I think is so interesting about the share economy is how different it can be. It can be that you're working with people who are driving and they're driving you around and helping out in a way that normal people have never helped in the driving world, or hosting. Now, question for you is, who is your crowd and who are these people who are participating in it on your sites? For us at Indiegogo Life, we find that it's actually a combination of 2 different types of folks, really. It's the people who are running their fundraiser, and you might consider them your power user, and then it's usually their community. It starts off with people they already know, people who are their friends, their family, who help to support them in the early days of their fundraiser, which then provides the social proof that helps to get larger networks of crowds involved, secondary networks, friends of friends, and then ultimately perhaps strangers who resonate with the project for some reason. Maybe they've had a similar disease to the one you were raising funds for, or they went to your alma mater, reasons like that. So it's sort of this double layer of crowd, and I'm interested to hear from each of you what your crowd looks like.
So our crowd is mostly moms. It's either people who are new to a community or moms who are pregnant or have just had their first baby. And it's a developmentally important time for men and women as you become a parent. And it's a time when you reach out and you start to form identity through your relationship to others. And there's a lot of seeking information and seeking normalcy. Is this normal? Is what I'm going through common? And it's a community that tells stories to each other, that asks questions through storytelling. This is what I'm dealing with. How did you manage it? Breastfeeding is hard. What did you do about it? And that input from a community who then tells their story builds the trust that makes the information on there more valid.
So I think one of the coolest things about CrowdMed is that our community is open to anyone who wants to help solve medical cases. We don't limit it to just people working in or studying medicine. And what we found is that it gives patients the opportunity, patients who have gone through these rare or difficult to diagnose conditions themselves, to help other people in that situation and prevent them from going down the same path that they went down. And they become more expert in their condition than any of the doctors they've seen or talked to. And they're really good at solving cases because they've done the research on a variety of conditions, not just the one they ended up being diagnosed with, but everything they thought they had. So they read those symptoms on our site for another patient's case, and they're like, oh, I know what you had. I know everyone else is telling you this, but I've already tried that, trust me. So we're able to capture the wisdom of patients who would, under normal circumstances before our site, would do all this research on their own, and the usefulness of that research would end with their case. They can now help a lot of people around the world with the work they've already done. And a lot of, about 40% of our community are patients and people outside of the medical industry, right? Outside of working in or studying medicine. And then 60% of them are made up of people who really love doing this as their job, right? There's med students, there's physicians, retired physicians, researchers, people who are currently practicing medicine, anyone who wants to hone their skills or kind of learn more about what's out there, since our site attracts kind of the really, really interesting cases.
For us, I would say it's sort of an evolution for moving initially dealing with healthcare providers. A lot of the things is there's many insights, clinicians have over years of experience. The question is, how do you disseminate that level of insights, those set of knowledge across the board so you can apply that to thousands of millions of people at one time? And so we work, and recently we were engaging with one physician, and he was like, well, if you start seeing people with a particular characteristic with a lab result, MCV that's elevated, you need to start asking regarding sort of drinking habits and things of that nature, which we had talked to other physicians and they weren't really thinking through those lines. And so it's really an issue of how do you go ahead and basically upscale everybody that's possibly currently practicing medicine. Sort of as the evolution as we go from sort of dealing with care providers to now directly engaging with patients themselves or all of us, the goal at that point would really be about how do we disseminate and engage that collective wisdom as well. So it's kind of a first step, second step.
Yeah, thank you. Maybe going on top of that, when you do find that it's time to go to that second step and you've helped perhaps individuals over and over, and now you say we find a pattern and it's time to help it at a larger level, what are you thinking about there? What are some ways you've either done that to date or you're excited to do in the future?
So towards that, as we start getting these insights, what we do is first, make sure that it's statistically valid and that it's something real behind that, right? Trying to be very rigorous with respect to the science. But once we do, what we really try to do is then we apply that to, and the partners that we deal with both health systems, health plans, ACOs, et cetera. We work with all of them, and pretty much we therefore, and towards your point of stories, what we really think that we do is we try to help create or tell basically people's health data stories, right? How do you take all these thousands of different data points that we're collecting from all the way with sensors and wearables to otherwise and synthesize that to be able to tell the past story, but also where that story is going. And so what we do is basically add these insights that we have and are able to apply them and then deliver them to the people providing care for those people. And that's how we're sort of distributing those sets of insights that are applying. And so recently we're working with a physician, they're being used every day, and we were like, hey, we believe this person has sleep apnea. And unfortunately that young lady was having problems sleeping, and they were attributing that to her depression. They weren't really even thinking about that, but now that we got them to thinking about the situation, they analyzed it, said, yes, you're indeed correct, and actually starting to get the right course of plan of treatment. So it's being able to do these things and be able to drive those insights into those patient data stories that really have really helped deliver and improve the care, for people today. So we're excited by that.
Yes, wonderful. And Jessica, I bet that you have a similar set of insights that you're able to have. I can only imagine the types of insights you've had after working with all of these patients. Are you starting to think about how you build that up and share your stories on a wider scale?
Oh yeah, we definitely have a lot of great success stories from our patients who are, of course, very grateful after suffering for years without an answer, finally getting an answer. So they always write us in about everything they've gone through really, and that's actually part of the case submission process. For a patient who's putting their case up on CrowdMed, there's a whole section in there where they can fill out this story, because there's a lot of clues that help the people solving their case in there about their lifestyle or about what they've gone through before, or what could have initiated the symptoms that they're experiencing. The stories are really important, and they actually help connect the people solving that case to the patient on another level. Like there's so many cases on the site right now, and a lot of what helps medical detectives decide on what ones they're going to devote a lot of time to researching with and connecting with the patient through is if they have a compelling story. So the stories are incredibly important, and we've been finding this too with running our cases on Indiegogo Life, as I'm sure you know, you're an expert on, that stories are incredibly important when trying to engage anyone to help with anything, really. And we've been utilizing those as well to get people to help each other solve their cases.
Yeah, we find that over and over again, that the number one key to a successful fundraiser always comes back to the person who's running it and the person who is benefiting from it. So we really encourage people to share their personal stories, and especially in the medical space, that can actually be quite hard, right? Because it might be a story that's quite private to you, or it's one that you haven't shared before, or it's that you're running a fundraiser for someone else and you care about them so much that you almost forget to share your own story. But being clear about why you're bothering to help somebody and how you're helping them and who that person is really makes all the difference on Indiegogo Life and frankly on Indiegogo as well. Even the biggest hardware campaigns that raise millions of dollars start with the story of the person who is running that campaign.
Yeah, so it's interesting you mentioned that, actually, because a lot of our patients, they want to be anonymous, or if it's a parent posting a case for their child, they don't necessarily want everyone out there and for the rest of that child's life for everyone to know what condition they're suffering from, or to know their symptoms. Some of those symptoms are pretty embarrassing. So initially, we kind of had this disconnect when we started our campaign. Was we wanted to do this broad fundraiser for everyone who was suffering from undiagnosed conditions, but we couldn't talk about the individuals on that level, right? Because people didn't want, you don't always want to go up there and be like, oh, I'm suffering from chronic diarrhea, for example. It's not like something you just blast out to your community and you're willing to share this campaign for. And that did make it difficult initially, and also kind of made it hard for people to share their cases on the site. And what would happen is people are starting to get more comfortable having that information available. It's an interesting thing we're seeing, where we're so comfortable sharing all the good stuff in our life on Facebook or Twitter, and then anything that goes wrong, we're suddenly silent about it. And what I've seen recently over the last 2 years of running CrowdMed is that people are kind of embracing that as a real part of their life, that it's okay to have things that are happening to you. And I think that Indiegogo Life happened to launch at around an ideal time, where people are more accepting of that and more willing to reach out to others for help, and then post their campaigns on their social networks and say, like, hey, I'm actually going through this tough time. I know I usually post pictures of me in Hawaii or on these crazy trips, but actually bad things happen to me too, and I could use your help.
Yeah, thank you for sharing that. And we're finding also that funding and giving through crowdfunding can be in a very effective way to help each other, rather than perhaps bringing over, Tupperware and making your friends have to then clean the Tupperware and give it back to you. And actually giving contributions can be a very resourceful, effective way to help in a time of great need.
Yeah, one of the things we talk a lot about population health, and what I find funny about that is, I say populations are made up of people, so why aren't we also focusing on the individual stories, right? Because a population is very amorphous. It's not, you can't connect to it really, but you can connect to people, right? And so I think that's something we like to keep raising into people's attention, is it's the people that make up these populations that matter, and it's their individual stories that matter, and it's what we can do for each one, and each one benefits everybody else. So it's really an extraordinary opportunity from that perspective.
Yeah, Lisa, I'd love to hear an example of what a parent group might support each other through, and how those folks come together, both online but also offline.
And I think, listening to what you guys are saying about people being protective of their information, I think, and mostly it's moms, and there are dads that are participating, but for lots of cultural reasons, that would be an entire other panel. It's mostly moms. It's already a trusted community, and, some of these clubs are moms only, and they don't allow men because they want to have a safe space to discuss very personal, private things that are, postpartum issues that they're dealing with. So there actually is a lot of really personal conversations that are going on online within these clubs. And I think part of that is because they're perceiving it as a community that is similar to them, because they're very locally, geographically based. And then I think also it's reinforced in in-person events. So, we were talking earlier, playgroups has become sort of a cultural icon and a developmental rite of passage for a lot of moms. And you go from your, Sex and the City crew that you go out to happy hour with, and then you have a baby and you can't go to happy hour anymore. So you have this playgroup that you sit down and you talk to about the issues that you're dealing with, and you share a lot of this information. And I think that where a parent club or an in-person community really serves is to normalize experiences, provide a place to ask questions. When you're participating with, say, again, breastfeeding is such a hot topic for new moms, maybe a lactation consultant, and you're dealing with a lactation consultant, and as a mom, you're like, is this okay? Is what she's telling me right? I don't understand why this is so hard. I don't understand why this hurts. And then you can talk to other moms and they can say, I've been through that. This is what we did. They normalize the process. The mom can then participate with her healthcare provider in a way that can be self-advocating, that can be reinforcing. And then I think when there are healthcare issues, whether it's a new baby or some sort of crisis that's an ongoing condition that can't be diagnosed, that support network not only participates in reinforcing the information, but the rest of your life can really start falling apart, especially as a parent and you're, trying to deal with kids' issues and, school and all of the other things that parents do. And having the support of your community, whether it's bringing Tupperware or, taking the kids to school and doing pickup and drop off for you, or, being able to get on a service like care.com, or there's others that do a similar kind of services to bring in, someone that's going to drive you places or someone that's going to help with the kids. I think all of those things reinforce the normalcy, the ability to advocate for yourself, and the ability to participate in a meaningful way in your own kind of path when it comes to your health.
I just wanted to emphasize one thing I think you mentioned I think is really super important is understanding what normal is. Everyone has their preconceptions, through a lot of external influences, whatever. And understanding what normal is actually allows you to say, you know what, things are okay, right? And I think the problem that we have a lot is we don't understand normal, right? And so anything that helps us do that, I think, is extraordinarily powerful.
Mm-hmm, mm-hmm, mm-hmm.
Yeah, another point that you bring up is the role of experts in the share economy, and I'd be interested to hear from each of you or anyone who has the thoughts on it, what role they do play, and is this new share economy thing complementary to the role of experts, or is it usurping their role, or how do those folks work together?
I mean, I think what we see really, and this is where care.com and the parent clubs really connect well, is that a lot of the questions that are in these forums and discussions that are happening in person are, what did you do when? Who did you go to for? And it could be everything from, like I said, the lactation consultant to a new OB because you're having problems in your pregnancy, to the person who comes and deals with the plumbing in your house. And it's how have you done this? Who are the experts that you've brought in? And there's a lot of shared knowledge of, this was my experience, but there's also a lot of asking of, who was the occupational therapist you used when you had swallowing problems with your baby? What did you do when your child was a super picky eater still at 7? So there is a lot of ties from knowledge sharing to experts. Mm-hmm. Yeah.
As I mentioned earlier, 60% of the people on our site who are helping solve cases are experts. They do work in or study medicine, and they're there doing what they love. They got into medicine in the first place because they wanted to help people. So this helps them continue to help more people on a greater level and increase their influence, right? So we're just working with experts, really, and we're empowering patients to find a way to get more information about their condition and reach a wider audience that has more answers for them, rather than just being limited to the information that the doctors they're able to access in person have. And so they can go back to that doctor with a report that they get from CrowdMed and say, I reached out to all these people, or these people all reached out to me, and they suggest this diagnosis. Have you considered that? And a lot of times, that physician's never even heard of it because it's pretty rare, or they didn't consider it because they were trained that if they're considering a rare condition, they should probably look in the other direction because that's rare, that's unlikely. So it helps them actually think of things from a different perspective, right? It brings them more information with which to do their job better and help the patients, which was the point of why they're doing anything that they're doing in the first place. So it's been helping them. We've gotten really positive response from people who are working in medicine, and very positive response from people who have retired. Retired physicians are just really excited to continue doing what they love without all the, everything else that comes along with having the full-time job, right? They just get right to talking to and helping patients.
Yeah, I think there's a very complementary reality. I think any expert who fears questions or comments from the crowd, one may say, is not very sure of themselves and not founded on strong, solid evidence or science. Half our team is physicians, the other half are data scientists, and we really try to bring these two things together because we believe there is a role for people who deeply study a particular domain, and as you said, they're there to help people. That's why that was their focus and purpose. But I think it's the more nuances, and also, as you also mentioned, the people living with these diseases themselves are, in some senses, the true world expert, right? Who better else to truly know the realities of a situation than that person who experiences it on a day-to-day basis, right? And so it's by bringing these, multi-dimensional, one may say, experts together with people who can think differently or be able to analyze things differently. I think it's all to the betterment and hope of how we can help people live better lives, and I think we should always support that. So.
Yeah, and maybe you could talk a little bit about your work with institutions and how have you found the institutional response to be to the crowd and that kind of space as well.
So I would say it's in some ways mixed, as I'm sure everyone, and the concern is not due to the goal or desire to find out the truth. I think most clinicians, or from that perspective, their major concern is they don't want people unnecessarily chasing down rabbit holes, though every now and then, of course, it is the rabbit hole that one must chase down, right? But, it's a question of when and whom and why and how to gain when that is. And so this is an evolving space in reality. We talk to tons of people from large health systems, academic medical institutions. How do they research? How do they discover? How do they find new ways? And in effect, how do we have Science 2.0 where the data speaks to us, right? But if we think about that as well, it's also how do we get more eyes on the data to come up with more hypotheses to engage with what's going on. And so I think a lot of them are trying to figure out venues and avenues of how to accelerate that and bring in the extraordinary opportunities. The problems are, how does one do so in a way that you can ensure the privacy and the care for the individual? How can you do so in a way that you're not inappropriately, worrying or terrifying the patient, and how you're truly supporting that person within their journey? I think those are the things that people care about. I don't think they've come up with answers. I think data science and these things are one part of the solution. I think there's, however, the extraordinary other part, and it's sort of marrying these variety of different angles that I think we will arrive there, but I think we're still just in the beginning of that journey.
Thank you. One of the pieces that has come up in a couple of your comments has been the speed that the technology has enabled for moving forward knowledge and insights. Is that the key value of our connected world today? Is it speed, or what are the key values that you're seeing the work you're doing in a technological era bringing to people?
I think when it comes to these clubs, you're really leveraging the capacity of volunteers through technology. And so it's not necessarily speed, but it's the what are you spending this valuable free time doing? Are you spending it managing technology systems, or as it used to be, 3,000 checks moms processing 3,000 checks in a room once a year? Or are you spending your time building relationships, connecting your community, creating opportunities for people to connect with each other? I think that that's really the place of technology in that space. I think there's a lot of room for improvements in Big Tent and a lot of platforms that are serving moms that are trying to create this connection and trying to help reduce the overhead of what it means to sort of be the CEO of your family. And I think that there's a lot of room there for improvement.
I think one of the big things that our technology is doing is giving people who have the skills and knowledge and didn't necessarily decide to take the life path of going into medicine, still giving them the opportunity to solve these really tough cases and do what they enjoy, and really connecting them with the people who could use that expertise. It's kind of cool. You now have, this used to be something that was limited to people in one domain, and now if you think you're really good at solving these puzzles, it's really like a challenging puzzle. And there are people out there who just live for this and want to spend their time figuring these out. But you don't really get access to a whole lot of patient cases. You have the rare disease news column in the New York Times, I think it was, that you could write into every once in a while to try to solve that case. But now you have tons of these, and you could actually save someone's life with the information you have. We're giving people the ability to use that knowledge and that skill on a level that they haven't been able to do before.
I think there's a variety of things. One thing I always ask ourselves is, can big data help us make us more human? If we think about one of the major challenges that we're having overall, it's an issue of scale. It's an issue of how is it that I can get access to as much brilliance as possible, and how can I do so in 2 minutes or less, right? I mean, the problem is, how do we get it on demand? How do we scale? And with technology in the way, by dramatically enabling communications to large numbers of people, enabling basically asynchronous ways of people volunteering their time, by enabling big data to be able to be the microscope for us all and allow us to see that which we could not. It's enabling us in some senses to be able to focus on the things that truly matter, and as you articulated, the relationships, how we actually communicate and connect with each other. And so, in some senses, my hope is that, as was previously mentioned, I think someone said, can technology, make technology more human, but can technology make us more human by truly being able to connect with others and be able to spend that time that in the parts and meetings and basically encounters that matter? And I think the answer is yes, and so I'm excited by where we're going.
And I might add that technology isn't the end-all be-all, right? What we find with our fundraisers is that sometimes people think they'll throw the fundraiser up and the crowd will come, but really you actually have to stay quite engaged with that effort and go back to the page, post updates, share what you're doing. I'm sure it's same with a parent group where you need to stay engaged with that community. It doesn't just run on its own. So that piece of keeping that humanity, keeping that connection is really important. For somebody who might be interested in this space, maybe they're excited learning a little bit more about the share economy, what would you say are some skills or some areas for folks to develop if this might be a place they want to pursue?
I think you guys go first, because I think the healthcare is more, applicable to the crowd.
Well, I mean, I think we're at an extraordinary juncture in healthcare today, not only here in the United States, but actually globally. The ability to generate and capture these extraordinary amounts of data is coming online. The ability to communicate to anyone, anywhere in the world, literally almost instantaneously, is there. The opportunities to connect or empower the different aspects of this are just almost impossible to count, and I think the opportunity is there. What I would really say is sort of, if you really want to engage, is find that which is your passion and really be able to delve down deep into that. It's by combining that, your deep understanding of a particular area. It could be relationships. You know how to really make relationships, or you know how to bring a crowd, or you know how to really analyze data, whatever the case may be, and build and run with that passion. Because another aspect, it's not going to be an easy task. This is not necessarily a fast-moving industry. It takes time. because also the fact is what you're doing is you're working on affecting people's lives, and so you do need to be cautious and understand the fact that the things that you do will impact people, and you got to be respectful of that fact. But I'm very encouraged by the opportunity, and I would just sit there and say is find that which is your passion, find that which is what you believe is your your differentiator, your thing that your insight, and run with it.
What I've learned from working on CrowdMed for 2 years is that people know a lot more than they realize. You have all this information you're accumulating from the people around you, from your family. Like people, you've probably been sick before, someone in your family's been sick before, you've had to care for someone before, and you learn about their condition by being around them or by talking to people on the plane or in the other situations that you end up in. We've actually heard stories of people getting the correct diagnoses from the person who sat next to them on the plane just because their sister happened to have the same condition and they had to help with that, right? So whether you're aware of it or not, you're absorbing all this information, and you might find that it can come out at times when you least expect it, or it can be helpful for a variety of people online. Like if you have been paying attention and you go on CrowdMed and you read some symptoms and you think, oh, I heard about that, or oh, my aunt had that. You have more knowledge and power to help people than you realize, is what I've been finding. And when people go on our site, for example, or go on Indiegogo Life or these platforms that they connect with all these people who are having these situations, and it triggers these memories that they have of being told this information before, they realize like, oh, I can apply that and can really have a huge impact on helping people with their condition or with their fundraiser or whatever it is that you've come across in your life. That's a kind of really cool thing about being able to connect that many people together, is because everyone has such diverse experiences, and you don't know where the overlap is. You don't know where the insight will come from, and that's kind of the key power in what we do and what a lot of these online platforms do. Is the insight can come from anyone.
And I think what I would say is that as you're looking at your organization or business or practice, that you really start with the who, and that we go back to our activist sense of building community. Be a student of community building, whether you call it social impact or social enterprise. Really think about the dynamics of the community that you serve and how you can participate in that and help that community build from the inside out. Take a look at the Obama campaign or some other, pretty well-known community building strategies, and see how you can integrate those into your organization so that you're building a relationship with the people that you serve. Because ultimately their wants, their needs, their desires, their stories are what's going to help you build a better product. And so your ability to engage in that community and have them trust you and really provide that information, I think, is going to be key to us building services, companies that truly are solving our community's problems, rather than creating a problem and then providing them a solution to it. If we're really invested in our community, I think that feedback loop is the ultimate way to build products that are useful and meaningful. And I think that that's what all of these companies are doing, is that they're very invested in their community's dynamics.
Yeah, just after thinking about what both of you said, it's really about focusing on the value of what you're delivering and specifically whom. And at the end of the day, our goal is to help people live better lives. When some of the previous stuff done, we've had 10 million people utilize it or more, come back and email us, and thank us, because you give to get. And so what I would say, one of the key things I say is don't just worry about give. People will return back. And I think that's sort of a core thing that I found is that as you provide value, you get back. So I think that's really the core that you want to focus on.
Mm-hmm.
Yeah, thank you for sharing those thoughts. And I've been in a company that's been around since 2008, so it's a little bit like a startup in a company to launch Indiegogo Life, and I've really enjoyed the process of delving in to understand a specific use case and what we can do to best help them, and launching this site. I think there are pros and cons of doing a company within a company, and that's been really neat to explore. All of you have really been on the founding teams of your own entity. I can only imagine that brings with it a lot of challenges. What are some challenges that you faced, and what is advice you give for folks who are in that early stage of building a company or nonprofit or project?
I think my co-founder Amaranth Lee and I, we met in 2009 and decided we were taking over the world.
And I think our challenge has really been to really define what that means and to bring it down to something that's actually executable, something that you can actually do, some way that you can enter that market, enter that space, some way that you can start. Because we spent 2 years talking about how awesome this whole thing would be, and finally we just had to figure out how to start. And it went in a different direction than we expected, but a much more successful direction and faster than we expected. So I'd say being able to crystallize the beginning, the first step, is something that's challenging but absolutely necessary.
So for us, it was building the thing, right? We kind of had this crazy idea based on the wisdom of crowds that we wanted to see if a crowd of non-experts could outperform individual experts. And when we ran our test cases, we did 20 cases that had already been solved by the traditional medical industry and had cost 6 figures in several years, dozens of doctors. And we had solved all of the cases, all 20 of them, in a matter of weeks. We got to the same answer using a crowd of people we got from Crowdflower or Mechanical Turk, if you're familiar with that. So people who are getting paid cents, right, to try to give their best shot at figuring out a case. And it performed wildly better than I think we were initially thinking. We had high hopes, of course. We're like, this is a cool theory, and if it works, we can help a lot of people. But when we got 100% of the cases right, we're like, wow, shoot, we better, crank on developing this. And then we found out we'd be launching for TEDMed in DC 2013. So we flew out there and spent 3 days. We stayed up for 3 days straight coding to get ready for that launch. And that's a challenge, if you can imagine what your code looks like after not sleeping for 2 days and being stuck. I mean, for me, stuck in a hotel room with 2 other guys. They're gross. It's like, yeah, I mean, true story. So yeah, there's the challenges of actually building the underlying technology and then launching it and then getting it in front of the people who need it, right? Like partnering up with the people who can get our site or our product in front of the patients who could benefit from it. There are patients out there who are suffering from, they're undiagnosed, they don't know what's wrong, right? But they don't necessarily know about CrowdMed either, so they just continue not getting an answer. We don't want that. That's why we built the thing. We want people to find out what it is they have so that they can start getting treatment. So that's the other challenge, is getting it in front of the right people. And then, of course, we're always working on improving the technology. So it's this constant cycle of iteration. We test it, see what happens, we get feedback, and then we improve, always improve. And startups are hard. It's exhausting. We've pulled a lot of all-nighters, but we make it happen, and it's rewarding, and it's exciting, and being in a startup is challenging itself, and to put that on top of that, have the kind of challenges that you get from being in medicine, where you hear these heartbreaking stories, and you're not always able to help everyone, and that's like a whole nother level of stress, company stress. It can start to get to you, but at the end of the day, when you get that message from a patient or you user in some cases, and they say, "Thank you so much, you saved my life. I don't know what I'd do without you guys." It makes it all worth it.
I would say that, first of all, passion is required. As you were saying, it's not an easy route. It's something that you have to spend 120% of your time, days, weekends, nights, whatever it is, 3 nights in a row with whomever. It's sort of one of the key things towards what you also said was getting actionable, knowing what it is your end goal, but having a very clear plan of action. At the end of the day, one of the things that I've always looked for is every day, how do we have visible, measurable progress, right? Can I say today that how we moved forward from yesterday? And that's sort of a key thing of creating actionability. And part of that is also the team. Make sure you have the right people around the table. Today with technology, with skills, one person can do a lot, but it's amazing what happens when you have a team. And, as we talked about, sharing, give and you get. And so can you get everyone in the world to be part of your team is a question, right? And so, I think those are some key parts that are there, and make sure that at the end of the day, the value that you're providing, when you can hear stories, when we hear stories, that you've helped someone live a better life, that you've diagnosed them earlier and got them the right course of treatment, I mean, for us, it's like no tomorrow. It's an amazing day. And, you know, what's great is that we get to hear that many days. And so that's very exciting to us, and, you know, these are good. So, but to say the least, it's not fast. It's a lot of work. You need the passion. You need the team. You need to create actionability. But if there's a will, you will find a way. Mm-hmm. And that's pretty much about it.
Thank you. And I have maybe one or two more questions, but I want to pause for a minute and open it up to our group to see if there are any questions from our own crowd here today. Yeah.
So I love the idea. Thank you so much for sharing your perspectives on the shared economy and how we can solve problems together. One of the things that when it comes up, I feel like is where does privacy come into some of these things? Because that is something a lot of people are think about before they start to share their stories. That could that's where the value that we've been talking about comes from. But there are a lot of privacy concerns, security concerns in this, and how would you address this in your areas?
Sure. So the question was on, just for everyone can hear, on privacy and how you address concerns in that area in your work.
I think since we're not a healthcare organization and we don't fall under any of the HIPAA regulations, we have a little bit different perspective. I think that the privacy and security of it has to do with building the trust that people are going to be, willing to expose themselves and willing to ask the questions that are really meaningful. And that's done through pretty clear guidelines about sharing the information. Originally, the platform was not built to link to Facebook. There was no sharing the information outside of the group. We've added some of that, but it can only be shared with people who are paid members of that group. So these clubs have sort of built-in information, built-in systems that you have to be a paid member, and so there's some assumption of privacy, security that go along with some very clearly communicated guidelines.
So by default, on our site, patients are anonymized. They get a pseudonym, and then all information that could tie back to them is concealed in some way, shape, or form. And what we've been finding more is that some patients choose to forego that and just want to be referred. They want their case to be referred by their real name because they like communicating with people in that way. But and also there's like high-profile cases where at that point they've been in the news and they don't really need the anonymization. But for the most part, people choose to just have their pseudonym, keep it, have the relevant data to help solve their case, but keep everything else private. And we give them the option to do that. In fact, that is like the default option.
I mean, as someone who works with large health systems and the rest, privacy and security is sort of paramount in what we go on every day. There's a lot of things to make sure everyone in the entire company is very aware of HIPAA, SOC 2 compliance, and really making sure everything's properly logged and things of that nature. But one of the things we do from a technology perspective, a little bit similar, is that we anonymize any piece of data that we're really dealing with. So we really try to mask names, identifiers, or anything like that when engaging from a course of analysis or presentation. But when you're engaging with that person's provider and that person, they want to see, well, was this Mary Smith? Was this John Doe? Who was that patient that I'm engaging with? Because that's their provider. So it's an important balance that we spend a lot of time trying to think about of how do we deal with privacy properly in a way that's meaningful, that allows the value to be generated. But once again, these are something that's evolving. I mean, as times they wanted to share, right? Versus other people are very private and don't. And I think health organizations, I think all of us are still learning of how do we empower the individual to make those choices, and how does that choice basically be able to percolate through the process. And so, it's an evolving thing, but it's something that we spend a lot of time thinking about how to do right, because in some senses we think about, well, that data is the same as our data. What I feel, basically like the golden rule, right? Treat everyone like you like to be treated. And I think it's sort of one of the core ethos of the company.
Thank you. Other questions? Yeah.
This one primarily for you, Jessica, but generally for everyone. When you do a solution, provide a solution, how do you vet the adequacy of that solution?
So this is kind of cool. we use a patented prediction market system, and the suggestions offered by the people who are solving cases, you get to, if you sign up for the site, for example, if you want to solve cases, you get a set number of points you start out with. And to show your confidence in the diagnoses you're suggesting, you allocate more points to it. You throw more points on it. And based on the behavior of everyone on the site who's participating in that case, we analyze how they're interacting and what amount of points they're allocating to each diagnoses. And our system does something in the background, right? We check it out, and we're able to assign a likeliness to each diagnostic suggestion. So at the end of the 30 days or 60 days or however long the patient wants their case up on the site, we're able to give them a report and say, we think you have a 20% chance of having this diagnosis, or a 10% chance of doing this of having this diagnosis, and they take that report to their physician and get tested for those conditions.
Maybe one more question from the crowd, and then we'll close out. We just have a few more minutes. Yeah.
I was just curious how much you've seen your technologies actually make their way out of the development process in your approach. So we've done actually quite a work with a number of people in India already. So we actually connected leveraging SnapGup with a bunch of village healthcare workers. And so before, what was happening was the village healthcare workers text back and forth with the physician for a particular case that they were engaging with. And so instead, they first ping the system. We basically work with them on an automated way to determine what is that right set of questions, aka building a much more detailed SOAP note and then capturing all of that and then sending it off to the physician. That helped really dramatically reduce the back and forth between them and the physician, and really basically made greater value of the physician's time, because if you just come back and say, hey, I have a young 7-year-old girl with a fever, unfortunately you've not given a whole lot of information. A lot more questions need to be asked. And so by being able to optimize the physician time, you're basically making the value across the board greater. That's one of the things we've done in the developing nation. Right now we're talking with other people exactly about how do we do what we do and be able to make that available through smartphones or smart apps literally everywhere. To basically democratize medical sciences. That's really one of our goals. So.
Yeah, and I might just add that I've been really inspired by the momentum we've seen on Indiegogo Life to help people around the world. Indiegogo has always been a global company, but on Indiegogo Life, the stories have been particularly inspiring to me. Most recently, after the earthquake in Nepal, we saw organically on the site more than 600 fundraisers launched to support relief efforts there that ultimately raised over $2.4 million from more than 20,000 donors, the largest of which was an effort by a Massachusetts General Hospital doctor who actually has a small nonprofit that was doing work in the medical relief space in Nepal already, and he was able, due to the fact that he had this unique experience and unique knowledge and unique network, immediately start to rally his network to provide medical relief, helping with surgeries for victims right away. So it was quite amazing. That fundraiser has raised almost $500,000 to date, and that doctor has since gone to Nepal and is helping on the ground himself as well.
And I think there's two answers to this. That at this point, in terms of parent clubs, it really is an affluent, upper middle class urban phenomenon. I think that moms are sort of the original and ultimate sharing economy. I think moms across cultures have always done this type of community building and support with each other as you're sharing childcare, you're sharing meal preparation. And I think that as our technology becomes more mobile friendly, which it has not been, that kind of community building can spread beyond these affluent communities, because I think that it's a matter of leveraging what women are doing anyway and really connecting with them in a way that allows them to build those communities in a way that they're already doing. And you're making it easier, you're making it more connected. And I think that that's really going to happen through mobile. I think that, that's what's happening with WhatsApp and all of these other, texting services, is that it's really building on the idea that people are connected in communities. And if you can do it in a way that leverages the relationships that are already going on, you're going to be more successful. In terms of Care.com, it is a global company, and it serves parents all over the world. The other part of it is that it is working to kind of balance the domestic worker market. the imbalance in that system of, affluent countries having a dearth of domestic workers, bringing them in from less affluent countries creates a lot of problems with, with not having the workers be empowered and, wage issues and abuse issues. And so if they can, Care.com is really working to work with countries like the Philippines that provide a lot of domestic workers, so that they can come to the United States and work here, and that those cross-border work relationships with countries are easier to manage.
Great. Well, we only have less than a minute left, so maybe we'll turn to our last question, which would just be, since we have so little time, in one word or one phrase or one sentence, where do you feel like we're at in the state of the share economy for health?
The beginning.
Accessible.
I think since we work so much with moms, I haven't really thought about it in the healthcare aspect, but I think that in terms of, communities of women supporting each other, that this is, like I said, been going on for a long time, and we're at the point of empowering and leveraging those.
Wonderful. Well, thank you so much to each of you, and thanks for being a wonderful audience. I think we're here for a few more minutes if you want to come grab us and have some quick chats, but wonderful to be here. Thank you.
Thank you.